Hello. So for my presentation, I had encounter groups, which was pages 256 to 261. So encounter groups, there are 6 types of encounter groups, which includes human relations, group human potential groups, T groups, training encounter groups, and growth groups. And all of these were developed in the National Training Laboratory. And these kinds of groups were mainly popular in the 1960s and 70s because it had an emphasis on creating a learning community, and it was built on trust and honesty, which was popular then. These groups are virtually extinct now, they're not very common. And a negative side of these groups happen to be that there was an unequal balance of power, which means um, basically the leader of the group had more power than the participants, which was not really a good thing. And another characteristic of encounter groups is that they were loosely structured, so there was no definite plan or agenda to them. So an example of a personal growth group in action is that a leader is hosting one of these groups, and the group is upset because basically there's nothing being discussed and there was nothing planned because of the loose structure. Um, Somebody will chime in and express that they're frustrated that nothing is getting done and that they're tired of this and they don't want to be here. So the leader basically comes in and says, it's your group. It's up to you to discuss what you want to discuss. It's up to you to express your frustrations, and that's basically what they did. They expressed their frustrations, and the leader eventually validated their feelings and told them that it was a good place to start talking about why they feel frustrated and why they're there in the first place. So basically, it's this example is basically just showing that the group had a loose structure and that the participants were um, responsible basically for talking about what they wanted in the group. Okay, so next we have the psychoeducational groups, which is pretty different because they had a structured agenda, and these were mainly based on instructions and not like feelings. So these groups mainly had to do with like career settings and goal setting, those kinds of things. And once again, it had definite goals, and it did have a leader that ran this group as well. And these groups were previously called guidance groups. They mainly take place in places like schools, rehabs, and substance abuse specialists will typically use these kinds of groups just to help set goals and future plans. The main goal of these kinds of groups is to help prevent future obstacles for students, for any participants in psychoeducational groups. So an example of this would be a leader that is basically talking to the group, and he is expressing how having knowledge and prior experience of these careers will help you in the future, once again, because they want to prevent future obstacles for these people. And he explains how these experiences can help clarify your likes and dislikes for your future, for your career. And he basically picks out this one girl and explains how she didn't want to work in a medical profession because she can't stand being sick or doesn't like being around sick people. So he basically would ask the group, for example, like, what profession do you think this girl should go into based off of the prior info? And that's the kind of things they would discuss in like a psychoeducational group setting. Another type of group is called counseling groups, and counseling groups are pretty similar to individual counseling, whereas they focus on solving interpersonal conflict. Um, the main goal of these groups is to help eliminate self-defeating behaviors. Um, Another trait of counseling groups is that they focus on brief treatment. It's nothing long term, it's mainly just like brief moments. And then they mainly focus on the present and not the past. So they try not to dig too deep into the past and they focus on what's going on now versus like what has already happened. An example is like a school counselor organizing a group of children with disabilities to express their frustrations. So therapy groups are, there's a little difference between counseling and therapy groups. However, specifically psychotherapy groups take places in like take place in places like hospitals, medical environments, or clinical settings, and therapy groups are mainly focused on long-term treatments, and it is focused on patients with diagnosable disorders. So anything long-term, like serious disorders like anorexia or bipolar, anything like that, and it is typically an intense analysis and has to do with structural personality change.